Could you tell me a little bit about the evidence-based medicine presentations that are part of the course?
Okay. Well, it's usual in most medical schools for students to study at some stage evidence-based medicine, which is an aspect of medicine that's been around for about 20 years. And what the research shows is that students will often look at the evidence base behind an investigation or a treatment or a drug, for example, but then when they're followed up in clinical practice, they quickly forget how to use those skills. So what we've done here at the University of Nottingham is encourage the students to identify a patient that they've seen on their primary care attachments, who has been particularly interesting and in whom they may have seen a clinical sign. And then, having identified a clinical sign, we ask them to go away and try and retrieve the evidence for that clinical sign and appraise it and then reflect on it. And by doing that, we are trying to teach them how to use the 4 key skills of evidence-based medicine, and that is formulation or identification of a clinical question or problem, the search for relevant evidence in the recognised medical databases, critical appraisal of any evidence that they find, and then, having found that evidence, to reflect on it and assess whether it applies in their particular patient, and then whether the evidence is also more widely applicable to the rest of their clinical practice. And the advantage, we believe, of them doing that in clinical patients is they're already using their clinical skills right from the first week of our course, and therefore, by identifying the evidence for a clinical skill and using clinical skills in an ongoing fashion in the early part of their course, we hope that it will reinforce their appreciation and understanding of evidence-based medicine and its merits.